Thank you very much, Hannah. We have 69 degrees outdoors in the valley, and from outdoors at the farmers market to indoors at the WJER studios, we have guests in the studio from Cleveland Clinic, Union Hospital. Two of you joining us, but first we'll introduce Dr. Rogers returning to the studio. Glad to have you back, sir.
Thanks, Laura. We're glad to be here. Excited to be here today.
And what brings you here for this month of October?
Well, as you know, October is Breast Cancer Awareness Month, and so as many of our topics that we want to discuss, we'd like to bring awareness of issues that our patients and the residents of Tuscarawas County may want to hear about. So
absolutely,
we absolutely want to talk about breast cancer and the ways that we can increase screening and earlier recognition and earlier treatment. So as you know, it's Paint Tusc Pink month as well, which is awesome, and we just appreciate WJER and your support as always, the Chamber of Commerce, and I think Trinity Hospital also is one of them, and just so many people in town, the businesses that support it and the things that they can do to be able to raise money for breast cancer awareness. It's just awesome. So it's a great time. We love that everybody's out there showing their signs and putting them up in their yards and in their businesses. And if you come over to the hospital, you'll see we've got a bunch of our pink signs out as well. So, and it's just really important. Obviously, breast cancer affects men and women, but mostly we think about affecting women, but about 1% of them can affect men. So, and so it's important just to remember that that's also there. But we're really going to concentrate on women today and the breast cancer screening program. So Raena Beans is with us today. She is our breast cancer coordinator, raised here in Tuscarawas County and living here still. And it's just such a great person to have in our hospital as well. And she does a great job with her team and really ensuring that our patients get the best care they can get. And she's got a great group of people too that work with her, many with 20 and 30 years of experience. So if our patients come to get their mammogram, that's never an easy thing to get, right? The mammogram is not a fun thing to have done. But when they do, our team tries to make them as comfortable as possible, especially with the amount of experience we have. So we're just glad that she's here today to be able to talk about what she offers with our program. And we're just glad to highlight her too.
And we're so glad to have you back in the studio, Raena.
Thank you.
And I know you bring lots of information for us, and I know the public, I'm sure, has lots of questions. What is sometimes the first question? Where do we begin with breast cancer screening? Tell us about the process. What is it? What are we doing?
So breast cancer screening really is just looking for signs of breast cancer before you really have like physical symptoms. So you come in, get your mammogram. You know, they say early detection saves lives.
Right.
So they're talking about coming in, finding cancer early makes it easier to cure, and studies show that using mammograms for breast cancer screening can actually lower the risk of dying from breast cancer.
Fantastic. And how common is breast cancer?
Breast cancer is the second most common cancer that affects women, and it does represent about 14% of all new cancer diagnoses in the United States.
Wow. Wow. So when should we begin the process? When should women start thinking about having mammograms?
So several organizations, including the American College of Radiology and the American Cancer Society, recommend beginning annual screening mammograms at age 40 for women who have, you know, an average risk of developing breast cancer. People who don't have a strong family history of breast cancer.
Okay, so if it runs in the family, it's something you might want to check out sooner.
You
than
should
that,
definitely.
But as a guideline for the general public. Okay, very good. All right, and what do we need to do to prepare for a mammogram? Do you walk in? Do you take that? What do you need to do to get ready for something like that? Anything?
Well, not really. There aren't a lot of special instructions for a mammogram. We do ask that you not wear deodorant the day of your test.
Good to know.
That actually can interfere with the accuracy of the x-ray imaging.
Okay. All right.
And you know, you want to wear comfortable two-piece clothing. You do have to take your top and your bra off in order to have the exam done. We do give you a gown that you can wear throughout the exam though as well.
Okay, so they're looking for cancer. What is it? What shows up? What do they see? Does it look like an x-ray? What?
So it is. The radiologist looks at the mammogram imaging and looks for what we would refer to as abnormalities, anything that
Okay.
appears to be a mass or calcifications, or there are some other small abnormalities that can show in a mammogram.
Things that may need closer attention,
Yeah,
closer look at.
absolutely. So if you have a negative exam, it just means that the radiologist didn't find any abnormal areas in your imaging, and
Okay.
generally will tell you that, you know, you can have a screening again in a year as long as you don't develop any new symptoms.
Okay.
If you would have a mammogram that had a positive finding, the radiologist will make a recommendation, usually for additional imaging,
Okay.
perhaps some additional mammogram views, an ultrasound, or other diagnostic testing, just to further evaluate that area.
Go from there and check things
Yeah.
out. All right. So what? How do I want to ask? How do you get started? I mean, if you say I'm ready, I'm going to do this. I got to get started with the mammograms. Obviously, you don't just walk in, right?
No,
Okay.
no, unfortunately. So the first step, you do have to have a prescription from your physician's office. So
Okay.
that's a conversation for you and your physician.
Okay.
And then you do have to have an appointment.
Okay.
Appointments can be made by calling Central Scheduling. You can call them at 330-364-0888. They are in Monday through Friday from 7 a.m. to 5 p.m. You can also schedule your own exam through the Cleveland Clinic MyChart if you are
very
a
good.
MyChart user.
Okay.
Mhm.
Very good. Thank you so much, Raena Beans, for
Yeah,
all
of
of that
course.
wonderful information. And thank you, Dr. Rogers, for bringing her here to inform us.
Absolutely, and we're just glad that she's able to get this information out. But you know, for a cancer that affects 1 in 8 women, it's really important for women to have this done. And we're really proud that over the years with Paint Tusc Pink, our rate of screening has gone up. And so I think we were almost to 70% last year, which is great. And
That's
we were
amazing.
not to that point before. So we really encourage it. And we know, again, not a great exam to have done, but it's really important to have it done every 1 to 2 years so they can compare it. That's probably the biggest thing. So you talked about calcifications and things that you can find. You want to be able to make sure that you look at it from the year prior or the 2 years prior, and that's really important as well. So, but again, a great group of teammates and caregivers that we have to be able to provide the care that they do.
And what a wonderful campaign with Paint Tusc Pink. It's a fantastic way to get the community involved in a fun way about a maybe not so fun topic, but thank you for making it fun.
Absolutely. Thanks for having us.
So thank you very much for joining us today, Dr. Rogers and Raena Beans from Cleveland Clinic Union Hospital with your medical minutes on WJER.